you suffer with chronic headaches, you're far from alone. Some 45 million Americans suffer with the condition. Our next guest says the source is all in your head. The source may be your teeth. His new book, Breakaway, chronicles a new method for treating chronic headaches, migraines, and TMJ pain without medication. We welcome Dr. Frederick Abeles here to Virginia this morning. Good morning, Dr. Abeles.
Good to be with you, Cheryl.
Good to see you. Thanks for coming in.
Me.
Let's first start by defining chronic headache pain, and why is it so difficult to treat?
Well, let me tell you about the life of a chronic migraine or TMJ patient. First off, you can't eat the food that you enjoy because the chewing hurts too much. You can't show up for your family the way you used to because of the pain. You can't play golf or work out the way you used to because of the pain. You may wind up going to bed in the middle of the day and pulling the covers over your head in pain. That's the life of a chronic migraine or TMJ patient. And if you think I'm exaggerating, spend one day with me in my practice. These people are just getting by on pills. They're just trying to hang on, and they're just trying to cope.
So why is it so difficult to treat? Is it because there's so many different causes?
There are really very few causes. One of the primary causes comes from muscle. So most of this pain, 90% of this pain, comes from muscle. If we really want to live pain-free, we've got to be able to create happy muscles. Happy muscles don't produce pain. Let me try to give you a little analogy. If I asked you to, I'm not, but if I asked you to hold your arm out like this for the next 5 hours, Cheryl, while you're doing the rest of your segment here today in broadcast, do you think you might start to get a little pain in your shoulder, radiating up your neck or down into your arm? So what happened? We asked some muscles to brace and support a joint in a position where they really don't want to be. We alter the physiology of that muscle, and we get a lot of pain. So now just imagine for a moment, if our bite positions our lower jaw in a position where it's really not supposed to be, and we're talking about very small discrepancies, then the muscles that have to try to hold and brace and support the jaw there, they fatigue, they stress, and they can create a tremendous amount of pain in the head and neck. The good news is, we can produce and create a simple little bite device that aligns the jaw where the muscles are happy and the pain goes away. I could talk for hours on the medical science of how this works, but we don't have time for that. When I go into the details at a dinner party, I can see people's eyes glaze over and they're like, why me? I only had one night out, so I'm not going to go into that. If somebody wants the details, they could read it in my book. But bottom line, it works. And it's very effective.
And that's one thing, because a lot of people turn to pills to try to manage the pain and get through the pain, but you say that's not necessarily the right solution.
That really isn't a good solution. We're just kind of masking symptoms when we do that and kind of kicking the can a little bit further down the road. If somebody really wants a good solution, they could find a neuromuscular dentist. That is a dentist that understands the physiology of muscle and pain. Our goal at the end of therapy, when we work with somebody, that patient's able to say, I'm back, I've got my life back.
And when we feel these kinds of pains, it's up to us to be proactive to find the right kind of doctor and the right kind of treatment for ourselves.
Yes, it really is. It all comes down to something like this. About 2 weeks ago, Cheryl, I saw one of our patients, Allison, and she told me, I kid you not, if her house was burning down, she and her husband decided the first thing they'd run in to save was her little bite appliance. She's been living pain-free for 4 years now. That's the impact that this type of treatment can have on somebody's life.
Amazing. Now you brought this little device here. What is this?
This is a cool little device. This is called Cephaly. It's the first ever FDA-approved medical device for the treatment and prevention of migraines. We use it in our practice. If you ever watch the show Shark Tank, Kevin O'Leary is an investor in the company. So it looks like something that you'd see that goes out of a Star Trek movie, but we wear it on our head for 20 minutes a day. It stimulates the trigeminal nerve, and it calms that nerve, which gets almost all of its input from all these stressed out muscles of the head and neck. It's definitely effective, and it definitely works.
Now that's amazing for someone who's suffered with migraine pain their whole life, and pills won't fix it. What is it about this that actually works?
What it does, its action is upon, as I mentioned, one specific nerve, Cheryl, that's called the trigeminal nerve. Nature's placed a lot of importance on this nerve. About 50% of all the input from our head and neck all goes through that one nerve, and it goes into the meninges in our brain. So if we can get that nerve happy and calm and get the muscles calm so they're not giving a lot of input into it, we can reduce or we can eliminate these headaches and these migraines.
Wow, a lot of people are probably going, give me that and give it to me right now.
It's prescription only, by the way.
So we have to see our specialist.
You got to see somebody. You got to see a doctor somewhere along the line to be able to use it.
Well, a lot more information in the new book, Breakaway by Dr. Abeles. Thank you so much for joining us today.
Great to be with you.
You're very welcome. And we will put a link to more information on our website at WTVR.com/VT.